morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the terms related to the body movement. So first is the in upper limb. Flexion. When two flexor surfaces are brought close to each other. For example, in elbow joint, when front of the arm and forearm are opposed to each other. Extension. When extensor surfaces are brought in as much approximation as possible. For example, straighten the arm and forearm at the elbow joint. Next is abduction. When limb is taken away from the body. Adduction. When limb is brought close to the body. Circumduction. It is a movement of distal end of the part of the body in a circle. It is a combination of flexion, extension, abduction, adduction in a sequence is called circumduction. For example, as in bowling. Next is medial rotation. When arm rotates medially, bringing flexed forearm across the chest. Lateral rotation. When arm rotates laterally, taking flexed forearm away from the body. Supination. When palm facing forwards or upwards. Pronation. When facing backwards or downwards. This figure represents the various terms related to movement of the upper limb. So first is circum, that is moving in the circular manner. Abduction, that is moving away from the midline. Adduction means that moving towards the midline. Flexion, that is bending or decrease the joint angle. Extension, that is straightening or increase the joint angle. Pronation, that is turning downwards. Supination, that is turning upwards. Next is the adduction of digits and finger. When all fingers get together, it is an adduction of the digits. When all fingers were separate, that is an abduction of the digits or finger. The axis of movement of finger is a line passing through the center of the middle finger. Next is the apposition of thumb. When tip of thumb touches the tips of any of the finger. Circumduction of thumb is movement of extension, abduction, flexion and adduction in sequence. Next is the terms related to in the neck. First is flexion, that is face come closer to chest. Extension, when face is brought away from the chest. Lateral flexion, when ear is brought closer to the shoulder. Rotation, when neck rotates so that chin goes to opposite side. Next is the opening of mouth. Lower jaw is lower to open the mouth. Closure of mouth means lower jaw is opposed to the upper jaw and closing the mouth. Protraction. Lower jaw slides forward in its socket in the temporal bone of skull. Retraction. Lower jaw slides backward in its socket in the temporal bone of skull. This figure represents the retraction and protraction. Thank you.